It is a serious problem, and I've found during my time in the legislature, especially the past few years, that Tennessee lags a bit behind in what we're doing for the opioid problem. We know it's one that covers the whole gamut of the population, and we know it's one that's growing really quickly. And I believe in 2016, we actually lost some 1,600 people from overdose that didn't make it. So, and that's only going to rise. I know that the governor this year, Governor Haslam, has just proposed an opioid program that is good. It's fairly comprehensive. I would say that the monetary investment is $30 million, and I understand some hospitals, larger hospitals, commit that much. So I'm a little worried about that, and also the fact that about half of that money is just state money, the other half is federal. The best thing I think we could do as far as opioid treatment and working on this problem is to do something that I think is the biggest moral failure that I've seen in the legislature in the 23 years I've been there, and that's the failure to expand Medicaid. I know TMA is certainly for that, and I have been for that for many years now. We have a little chart in my office in the legislature, and it just turned over $4 billion that Tennessee has forfeited by not expanding Medicaid. That's about $2.5 million a day. The good thing about it from a opioid standpoint is this treats folks who have the ability to work but don't have the ability to pay for insurance. It includes treatment for opioid dependency and other mental health issues that go along with it, and it would allow us to treat the opioid problem without our hands tied behind our back as they are now. When a day laborer or a person who works in construction, just if they don't work, they don't get paid, they go to their doctor and they get an opioid so they can make the money for the family. And if it happens too much, if that back doesn't get better, then they may rely on other things, other sources besides their physician when that physician says, I can't give you any more of these, And then they're addicted. They're not criminals, and they need to be treated like the medical patient that they are. So it just makes it better all the way around, not just for opioid problems, but for just general health problems, getting them on a good health regimen so that we know now that things like smoking and alcohol use and non-exercise and the type of food we eat makes a huge difference. And medical, not necessarily treatment, but medical care, I think can help that. I think it's very important because we see that we don't get physicians in rural areas. We may get one for 1 day a week or 2 days a week coming through on a circuit, and certainly if we were fortunate enough for somebody to live in our town and be a physician there and work through the local hospital or a local clinic, but it's not like it used to be. So we have to rely on a team practice where maybe that physician is at a separate location and a nurse practitioner or a physician's assistant or somebody who has that certified training. We need to learn how to work together and make sure that team approach continues so that we can glean from all types of professionals the best way to treat a patient. Well, I think, frankly, that the medical decisions don't need to be made by insurance companies. I think that they have to be made by physicians and by trained professionals in the field. And that's sort of the first thing I would say. Now, there has to be some limitations as to of costs, but I think we have opportunities by trying to sit down, as you said, and try to do a little patching as we work things out. And we've tried. I know TMA's tried. I know physicians in the legislature, because I'm in the legislature now, and I see them work for days. The speakers will say, get in that room and figure it out. And they try. They really do, both sides. But it's a tough issue. And sometimes, sometimes the cure is worse than the disease when you try to do something like that because of where we are. But the point is, as long as we let the health professionals make the health decisions and let the insurance companies use, as you spoke about the qualities of insurance, the requirements of insurance, have the ability to insure enough people to make things work, and some of those business decisions that they make, I think we can have really good care with adequate compensation for insurance companies. Nobody, it's one of those deals where probably everybody's going to be a little dissatisfied, but it won't affect the outcome of the particular case, and certainly won't affect negatively the health of the patient. We're part of a national healthcare situation where all states are struggling with this and other issues as far as payment and the rising cost of healthcare and all that. So I think one thing we can do is look at other states that have had some success in these, not try to reinvent the wheel at every point in time. And it's just like the episodes of care issues and the other issues. A network is there for a particular reason, and if you compress it so much where there's not any coverage there, then it does no good. So I think we both have to. When I say both, I think the provider and the payer of the insurance that's purchased generally by the patient or by the state on behalf of the patient. There has to be a little give and take there. I think you had the answer. Sometimes back when I was practicing law, if both parties were a little dissatisfied, you probably got a pretty good settlement. And that's the same way it is with legislation. When nobody's really happy or really sad, just a little of both, you're probably there. I've been fortunate to serve under 4 governors and have gotten to know the commissioners that 2 Republican governors and 2 Democratic governors have had. And by and large, I've been very impressed by the quality of people that come usually out of the private sector and come in and work for a governor and administration in a particular field. And I certainly think it's a whole person concept. Certainly you want somebody in the Department of Health who is a health professional. I think that's just like I would in Department of Education. I particularly would like to have a commissioner of education who has that classroom experience, as an actual teacher. In insurance is a mathematical type thing, and it's a economic type thing, and we have to have somebody that understands and knows that. But you also have to have somebody that understands that the mission of a state health department, a state commerce department, is not a profit mission. We can use business principles in all of this, but to say we need to run state government in providing health care, for instance, like a business, like a regular business, remember, regular businesses generally are there to make profits, or as you said, dividends to their shareholders, but government doesn't have to make a profit. The reason for government is not to be profitable. The reason for government is to serve the people that pay for government and that are our citizens. And the profit becomes, what we're talking about is better health care, is better use of the public funds, better use of the expertise that we have in state government. It's not just to make a profit. So there's a big difference in that. So I think if we have a person with knowledge, experience, and compassion in whatever field it is, I think we can generally say that we'll have a pretty good cabinet. Well, it seems to be a bit duplicative, number one, and it seems to not have the right purpose, number two. I think a broad-based or a quality CLE or CME, I think is the term in the medical field, is certainly sufficient, not having to do some extra things for a particular certifying agency. No question about it. There's no question about it. As I mentioned earlier, these factors that we just take for granted about diet and exercise. I mean, just for instance, there were announced a couple of large grocery stores closing in one of our states. And by closing those 2 grocery stores, we opened up another of about 300 food deserts in our state. By loss of those grocery stores. And what that means is there are no fresh fruits and vegetables in any type of convenient range for citizens. And they should demand more. They ought to know that, hey, we need fresh fruits and vegetables, not the kind of food you get at the corner Quick Mart and things like that. And that may just be because, we're just used to eating snack food and all that stuff. We forget about diet. and we forget about how to take care of our teeth, and our bodies, and all different types of things that we could do. So we need to listen to the professionals because they know what they're talking about, and I think we can really increase the overall health of our citizenry, from school kids to old folks like me, by doing some of those simple things better.